Yo, what is up, my Nakama? So my name is Daniel, and I'm a current third-year medical student, and today I have a super busy day during my internal medicine rotation. But today I'm giving a lecture for a case presentation at 8 a.m., so I was kind of excused from my morning rounds. But usually I'm up bright and early before the sun is even up, so it's kind of nice to sleep in a little bit today at least. But basically we were given a case description of a patient with certain symptoms, and we have to give our diagnosis and our differential and our plan as medical students, and then we're going to compare our plan to the actual attending and see how close we match up or if we completely butchered it or not. So I have that presentation at 8, and then afterwards I have a little surprise that I'm picking up for my residents that they actually told me to pick up. So I'll see you then. I hope you enjoyed this vlog. It's going to be a busy day for sure, but you know, let's get it. Dattebayo. Okay, so just got back from my talk, and it was actually awesome. We happened to get the same diagnosis as the attending, and then this wasn't based off of an actual case. So the pathologists, when they did the biopsy, they confirmed what the actual diagnosis was, and it matched with the attending's final diagnosis, and it matched with our diagnosis. And the final diagnosis was small cell lung cancer, and it's a kind of an interesting tumor. I mean, it's not a fun tumor. No tumors are fun, but it's an interesting tumor because it can present with a lot of paraneoplastic syndromes. So kind of a lot of potential antibodies or different disease processes that by themselves can present on their own, but they can be caused by small cell lung cancer. So for example, this lady had hypokalemia and hyperglycemia, and Cushing's syndrome can cause this, but the ectopic ACTH production was caused primarily by her small cell lung cancer. And she also had some anti-WHO antibodies, which is some antibodies that can target the cerebellum, because she had some kind of upper extremity dysmetria, meaning she had kind of difficulty doing movements with her upper extremity, which can be coordinated, those fine movements can be coordinated by her cerebellum, and small cell lung cancer can actually present with a paraneoplastic syndrome related to cerebellar deficits. So we actually got it, and that makes me feel really smart and not dumb. But yeah, talk went well. I'm really happy how well it went, and I'm probably gonna put it on my resume, you know, to get that cred, that internal medicine street cred. But now I'm going to pick up a surprise for my residents and my team so that we can enjoy later in this afternoon. Oh my God. Giant Amish cinnamon rolls. Look at how beautiful they look. I'm so excited for this. My residents, they're gonna worship me for bringing them these cinnamon rolls. Well, actually they told me to bring these cinnamon rolls. It's for this place called Lavender and Honey. It's such a good place if you live in Winston-Salem, which I don't imagine any of my subscribers do. But if you guys do, definitely check out Lavender and Honey. Their coffee's amazing. I got this coffee here. Let me do a taste test here. It's called Cafe de Luna. Oh my God, that's so good. So it's drip coffee, sweet cream, and a little bit of vanilla flavoring. And they mix it together with a little bit of whipped cream. That is so freaking good. Today has been a pretty amazing day so far. But now I have to go home and watch medical school lectures. Sad. Okay, so I just got back from the hospital, and I had a pretty good time at the hospital. So I helped admit a new patient. So I went down to the ED by myself, did the full history, did the full physical exam, and then wrote my HPI note and came up with an assessment and plan. And it was essentially the exact same assessment, diagnosis, and plan that the upper level resident had as I did. So she was pretty impressed, and it kind of goes to show that I'm learning a lot during my internal medicine rotation, and I'm learning how to think about patients and kind of apply my medical knowledge to an actual clinical diagnosis. So I'm glad I'm able to help out patients in this manner and actually do doctory things. But now I am dressed up in my workout clothes, and I'm gonna hit up the calisthenics park for a sick bodyweight workout. So I'll see you then.
Down man, stay man, I move like a waistband when I show the raise hands, 100 man down. Fist make a face plan, block a let the Ray bands, go with no hands when I knock them out. Ayy, giving out hands like I'm Luffy, I hit them hard, make them switch animations, they change from the show to the movies, Feel like the Hurricane, who wanna fight with me? I take them out with this two-piece, Outside they cabin when they say they want me, they gon' see my crew, no they losing, I be with this shit, we can throw down gear for a goddamn shot, let they find out, PJ cause I'm cold. Ready anytime my fist like white bear, earthquake, hands leave them weak in the bones. Ace with the fist, five scarf, run, I pull up on my legend when I scrap it, you leave him alone. Logie your body type, that shit don't face me, I'm bringing that fire, fist heat to these slopes. Down bad outcast, battle of the wheels, I'ma outlast, Cut that in a straw hash, worst generation, I'm the number one rookie, you a clown mask, Take man, club it down, hit him with the cover and bound man, looking like a loud pack, Years second flow, good, I'm thinking there's a sound like if I'm on a track, then it half fast, Ayy, I feel like Monkey D. Luffy, Activate you to my elephant, Gatling, go leave him all bruising and loopy, Seven lifestyle, GD, Buru Jambos, I'm hot as a Kino, like Ace with the rounds, 36 pound, can I aim at your mouth, color rock conquerors, I take them out. Head bash, every bitch I throw, I give a jet lag. See me get a new gear form, I'm leaving dead fast. Pull up with a gun pistol when it's one arm hit. You are a PO official, you a dead man. Show me any enemies and I'm right on the spot. Everything I'm giving, I crib and I'll make a drop. Hippin', I be spinning like I know I'm hitting God's. I'm running up, I get on my feel like I'm at the top. Wait, hey, so who on the beef? Feel like a cattle, I just be king of the beast. When nobody starts seeing me, tell me who on the heat. If your body in a building,